I'm about to reveal something that might shock you. Something that challenges almost everything you've been told about high blood pressure. For more than 20 years, I stood under the bright, unforgiving lights of operating rooms as a cardiac surgeon. I've opened thousands of chests. I've held beating hearts in my hands. I've repaired vessels no wider than a pencil. I've looked directly at the inside of human arteries, not in theory, not on a scan, but with my own eyes. And after all of that, I can tell you something with absolute certainty: high blood pressure is not what most people believe it is. You've been told it's about fluid. Too much volume in the pipes, too much salt, too much water in circulation. The explanation sounds clean and logical. Reduce sodium, take a diuretic, remove excess fluid, and the numbers drop. The monitor looks better. The doctor nods. Problem solved. But here's the truth that rarely gets spoken out loud. Lowering the number is not the same thing as fixing the disease. Hypertension is not primarily a plumbing issue. It's not just about how much liquid is flowing through your arteries. It is a structural issue. It is a disease of the vessel wall itself. When I cut into a healthy artery, it responds like living tissue should. It springs open slightly. It feels supple and elastic. There is resilience in it. It almost seems to breathe in my hands. The wall is flexible, responsive, soft but strong. When I cut into the artery of someone who has lived with uncontrolled or long-standing hypertension, the experience is entirely different. The vessel doesn't spring back, it feels stiff. Sometimes the needle struggles to pass through the wall. There is resistance where there should be give. Occasionally, there's even a subtle grinding sensation from calcification embedded in the tissue. That stiffness is the real disease. That loss of elasticity is what high blood pressure truly represents after years of silent progression. Medication can lower pressure. It can relax smooth muscle. It can shift fluid balance. But it does not rebuild elasticity. It does not reverse calcification. It does not restore the delicate lining that protects the inner surface of your arteries. To truly understand hypertension, you have to go deeper, down to the cellular level, to the microscopic structures that determine whether your vessels remain flexible or become rigid. Your arteries are not hollow rubber tubes. They are dynamic, living organs made up of 3 carefully structured layers. The innermost layer, the one that touches your blood directly, is called the endothelium. It is only a single cell thick, thinner than tissue paper, yet it plays an extraordinary role in your health. The endothelium is not passive. It actively regulates blood flow. It produces substances that prevent clots. It manages inflammation. It tells the surrounding muscle when to contract and when to relax. It helps maintain balance within the entire cardiovascular system. When the endothelium functions properly, blood pressure remains stable. Vessels expand when needed and relax at rest. Circulation flows smoothly. But the endothelium has something even more delicate protecting it, a microscopic, gel-like coating called the Glycocalyx. You can think of it as a soft, protective lining on the inside of every artery and vein in your body. It reduces friction as blood flows. It prevents inflammatory cells from sticking to the vessel wall. It senses changes in blood movement and triggers the release of nitric oxide, the molecule that signals your vessels to relax. When the Glycocalyx is intact, the endothelium stays calm and responsive. Blood flows smoothly. Pressure remains controlled naturally. But modern life is not kind to this protective layer. Repeated blood sugar spikes, chronic inflammation, oxidative stress from poor diet, smoking, pollution, lack of sleep, all of these act like sandpaper on the Glycocalyx. They gradually erode it. They thin it out. They strip it away. When that coating disappears, the endothelium becomes exposed. Inflammatory cells begin sticking to the vessel wall. LDL cholesterol particles slip beneath the surface. Plaque formation quietly begins. Nitric oxide production declines. The vessels lose their ability to relax fully. Constriction becomes more common than dilation. Pressure rises. And here's the key point most people never hear. Blood pressure medications do not rebuild the Glycocalyx. They do not restore that protective lining. They manage pressure numbers while the underlying vulnerability often remains. I once treated a patient in his late 60s whose blood pressure had been considered well controlled for years. His numbers were acceptable. His medications were consistent. Everything looked stable on paper. Then one morning he experienced chest pain that would not go away. In surgery, I saw the truth. His coronary arteries were stiff and heavily calcified. They did not resemble the supple vessels of a healthy heart. His blood pressure readings had been controlled, but the structural damage had progressed silently underneath those numbers. That experience is not rare. Hypertension can advance quietly, even when readings appear reasonable, because pressure is a symptom. Stiffness is the disease. Most people focus on systolic and diastolic numbers, but there is another measurement that reveals far more about vessel health: pulse pressure, the difference between the top and bottom numbers. In healthy arteries, that difference is moderate. The aorta, your main artery, acts like a shock absorber. When your heart pumps, the aorta stretches to absorb some of that force. When your heart relaxes, it recoils and continues pushing blood forward. But when arteries stiffen, they lose that cushioning ability. The top number rises higher because there is no flexibility to absorb the force. The bottom number may fall because there is less recoil to sustain pressure between beats. The gap widens. That widening gap reflects arterial stiffness, and arterial stiffness strongly predicts stroke and heart attack risk. Over time, chronic inflammation and metabolic stress transform the middle layer of the artery wall. Calcium begins to deposit where it does not belong. Elastic fibers degrade. Smooth muscle cells change their behavior and begin acting more like bone-forming cells. The vessel wall mineralizes. Many people assume that once calcium enters arteries, it can never be reversed. That assumption is not entirely correct. Calcium movement in the body is regulated by proteins that act like traffic controllers. One of these proteins helps direct calcium toward bones and away from arteries, but it requires proper nutritional activation to function effectively. Vitamin K2 plays an important role in that activation process. Without adequate levels, calcium regulation may falter. Vitamin D works alongside it by influencing calcium absorption and distribution. Magnesium helps keep calcium dissolved and prevents it from crystallizing in soft tissues. When magnesium intake is low, which is common in modern diets, the protective balance shifts. Calcification risk increases. This is not about megadoses or miracle cures. It's about restoring mineral balance and supporting the body's own regulatory systems over time. Then there is nitric oxide, one of the most vital molecules for vascular health. Nitric oxide is produced by endothelial cells and signals the surrounding smooth muscle to relax. When nitric oxide production is robust, vessels remain flexible and responsive. When production declines, constriction becomes more persistent. Pressure rises. Oxidative stress and inflammation impair the enzyme responsible for producing nitric oxide, but the body has a built-in way to stimulate its movement. When blood flows more rapidly across vessel walls during physical activity, it creates friction known as shear stress. That shear stress signals the endothelium to release more nitric oxide. Over time, regular movement enhances endothelial sensitivity and improves baseline vessel relaxation. Even modest, consistent exercise can improve vascular responsiveness. The key is regularity, not intensity. Breathing patterns also influence nitric oxide levels. Nasal passages naturally produce nitric oxide, which supports oxygen delivery and vascular function. Chronic mouth breathing bypasses that benefit. Something as simple as mindful nasal breathing can support the system in subtle but meaningful ways. Now we come to another critical, often overlooked mechanism: insulin. Insulin is widely known for regulating blood sugar, but it also directly influences how the kidneys handle sodium. When insulin levels remain chronically elevated, even in people without diagnosed diabetes, the kidneys retain sodium more aggressively. Sodium retention increases blood volume. Increased blood volume raises blood pressure. This explains why some individuals strictly reduce salt intake yet continue to struggle with hypertension. The issue may not be salt alone. It may be chronically elevated insulin keeping the kidneys in retention mode. Insulin resistance can exist quietly for years before blood sugar levels cross into diabetic ranges. During that time, elevated insulin contributes to vascular stiffness and fluid imbalance. Improving insulin sensitivity through balanced nutrition, resistance training, consistent sleep, and structured eating patterns can gradually normalize insulin levels. As insulin declines toward healthier baselines, kidney sodium handling improves. Fluid balance stabilizes, pressure eases. Hypertension rarely results from a single cause. It usually reflects a convergence of mechanisms: protective lining damage, arterial stiffening, impaired nitric oxide production, and metabolic dysfunction. Medication plays an important role. It can prevent dangerous spikes. It can reduce immediate risk, But medication alone does not necessarily rebuild the structural integrity of the vessel wall. Reversal is not dramatic. It is gradual and cumulative. It looks like months of stabilized blood sugar instead of repeated spikes. It looks like mineral sufficiency restored. It looks like daily movement that keeps vessels responsive. It looks like improved sleep that reduces sympathetic stress. It looks like steady metabolic healing. Over time, endothelial function improves. Nitric oxide production increases. Arteries regain some elasticity. Pulse pressure narrows. Medication requirements may decrease, always under proper medical supervision. No one should abruptly stop prescribed blood pressure medication. Structural healing takes time, and pressure must remain controlled during that process. Any medication adjustments should happen gradually and under the guidance of a healthcare professional. Hypertension is serious. The risk of stroke and heart attack is real, but the idea that it is inevitably progressive and irreversible is incomplete. Your arteries are living tissue. Living tissue adapts. Living tissue remodels. After decades in the operating room, I have witnessed both outcomes. I have seen what happens when vascular health is ignored. I have also seen what happens when patients commit to addressing deeper mechanisms. Energy improves. Numbers stabilize. Medication burdens sometimes decrease. Risk profiles shift. Hypertension is not simply about fluid in pipes. It is about the health, flexibility, and integrity of the pipe itself. Protect the lining. Support elasticity. Preserve nitric oxide. Improve metabolic balance. When you address structure, numbers often follow. Your blood vessels are not rigid plumbing. They are responsive, adaptable, living systems. And when given supportive conditions, they can begin to repair. High blood pressure is not a random event. It is a signal, a message from your vascular system that something deeper requires attention. The goal is not just a lower reading on a machine. The goal is arteries that remain flexible and resilient for decades. Because in the end, it's not about chasing numbers. It's about preserving the quality and integrity of the only vascular system you will ever have.